Okay guys, our next topic is physical adaptation to labor. So let's talk about your physical adaptation to labor. So talk about the physical adaptation to labor. Both the fetus and the mother will need to adapt during the labor process. So let's start first with the changes with regards to the adaptation of the mother. The adaptation of the mother. We'll talk about the adaptation of the mother, mga kapatid. First system na itong approach natin, mas maganda yung nasan, tama? Okay? Number one, we talk about the hemato or hemopoietic. Hemopoietic system. Tama may spelling ko? Hemopoietic. May idea. Hemopoietic system. So, hemopoietic system, basically the production of blood cells. Tama ba? Yes, hemopoietic system, the production of blood cells. Sir, anong significant event ang nangyayari kapag labor and delivery process sa mother? Nagkakaroon ng leukocytosis. O basic term to mga kapatid ha. Okay, tandaan nyo to, ever na ha. Kahit mag-board exam na kayo, huwag nyo kakalimutan. Cytosis means up. While pinya means down. O, lagyan natin dito ha. Cytosis means increase. Pinya means below or down. Okay? So below the normal range, pinya. Above the normal range, cytosis. Then ang prefix mo lang is the cell. So kailangan alam mo din ang pangalan or other name ng cells. Pag RBC, red blood cell, erythrocytes. Pag white blood cells, leukocytes. Then pag platelet, thrombo. Pag mataas ang platelet, ang tawag, thrombocytosis. Pag mababa, thrombocythemia. Pag mataas ang leukocytes, pag mababa, pag mataas ang erythrocytes, ang tawag ay erythrocytosis. Pag mababa, leukopenia, or simply known as anemia. Ulit tayo. Pag lahat sila mababa, ang tawag pancytopenia. Okay? Lahat mababa, pancytopenia. If all the blood cells are diminished, pancytopenia. Paano naman pag lahat mataas? Polycytosis. Are we clear? Polycytosis. Did you get that? Yes. Okay. Now, the effect is gonna be depending kung anong type ng blood cell ang bumaba or tumaas. Clear? Now, in order for you to understand that, you have to know the physiology of each blood cell. Now, RBC is for oxygenation, isn't it? Because it contains hemoglobin. Leukocyte is for infection control, while your platelet is for clotting factor. Clear? An increased platelet means clotting formation. You are prone to develop thrombus. Pwede kang ma-stroke, matake sa puso, kasi babara siya sa ugat. Pag mababa naman ang yung thrombus, ang tawag natin doon, thrombocytosis, meaning ay thrombocytopenia or thrombopenia, you are prone for bleeding. Leukocytosis, meaning you have an increased WBC, nagkakaroon ka ng hypersensitivity reaction. While a decreased leukos or leukopenia means that you are prone for infections. RBC, you will develop. Pag mataas, you will develop polycythemia vera. Pag mababa, you will develop anemia. Okay? Your problem is gonna be with oxygenation. Now, anong nangyayari daw sa mother during labor and delivery is leukocytosis. Leukocytosis is increased WBC. Question, what is the normal value of WBC? Normal value is around 4.5 to 11,000. 4.5 or 4,500 to 11,000 per cubic millimeter. Per cubic millimeter. Pag mababa, leukopenia. Pag mataas, leukocytosis. In cases of pregnant women, okay, nagkakaroon daw sila ng more than 25,000 to 30,000 cubic per millimeter na WBC. And this is due to stress and heavy exertion. Because the woman's body is under stress. Due to stress and heavy exertion. Due to stress and heavy exertion. Do you have any question? Question? Okay, let's continue now to the next system. Okay, let's continue to the next system. We talk about the cardiovascular. Cardiovascular. Pag sinabi natin cardiovascular, ito ang dalawang na i-monitor natin. Cardiac output and BP. Cardiac output and BP. When I talk about cardiac output, it is referring to the amount of blood that is exiting the heart, isn't it? Yes, and due to the pressure and increased blood volume of women, what happens to the cardiac output? Increase. Tama po ba? So nagkakaroon tayo ng increased cardiac output. And since there is an increased cardiac output, what happened to the peripheral pressure? Increases. Hence, also increasing BP. At the same time, stress ka, epinephrine lalabas. Tama? You're exerting, okay? And because of the compression sa mga blood vessels, nagkakaroon ng pooling of blood. And that pooling of blood causes hypertension, increased cardiac output that leads into hypertension as well. Are we clear? Yes. Number 3, respiratory system, RS. Respiratory system, RS. What happened to the respiratory system? Tachycardia, tachypnea, or bradypnea? By the way, in cardio, you can also put there increased cardiac rate. Tama ba? Yes. Okay, increased cardiac rate. O, dito naman tayo sa respiratory system. What happened? That is what? An increase RR. Tama ba? Yes, there is an increasing rate of respiration due to supply needed by the body. Isn't it? Yes, total oxygen consumption increases kasi 100% during labor. That is why respiration needs to compensate by gasping for more air. Yun ang tinatawag natin, respiratory changes during labor and delivery. How about temperature? Temperature. Question, if you are under stress, how is your metabolism? Increasing or decreasing? Increasing. Why? Because under stress, kapag pag nag-iiri-iri ka, okay, nagkakaroon tayo ng increased muscular activity. An increasing muscular activity means it requires the need for energy. Energy is equals to heat, isn't it? An increased muscular activity would also increase body temperature. Okay? Due to increased muscular activity. Due to increased muscular activity. Okay? Aside from that, okay, ang babae na nabubuntis, pinapapawisan hindi. Ay nanganganak, pinapapawisan hindi. So there is also diaphoresis. To maintain yung regulation din ng temperature. Kasi pag mainit ang katawan, kailangan i-release yung ibang init. Isn't it? Paano i-release ng katawan nyo? Sa magitan ng pagpapa-wes or sweating. Take note of that diaphoresis kasi may significant din siya na effect doon sa fluid balance ng katawan natin. Which is the next topic, fluid balance. So, fluid balance. Okay? Pag sinabi natin fluid balance, do we experience fluid loss during labor and delivery? Yes. What are the fluid loss na nangyayari during, nagkakaroon ng fluid loss? So what are the causes of your fluid loss? Diaphoresis. Diaphoresis. At nagkakaroon ng insensible fluid loss. Nagkakaroon ng insensible fluid loss due to increased rate and depth of respiration due to increased rate and depth of respiration. So that is your fluid balance. We are experiencing fluid loss. Okay? So due to several factors, diaphoresis and the insensible fluid loss because of our increased rate of depth and respirations. As I am speaking right now, I'm actually losing fluids. Okay? Kaya nga, pag salita ka ng salita, may nag-dry din ng lips, nag-dry ang mouth. Because you are actually insensibly losing fluids. As you breathe air in and out, you're also losing fluids. Are we clear? Yes. Number 6. O, favorite number nyo, number 6. Urinary system. Ano naman ang nangyayari kapag urinary system, sir? Urinary system. Do we lose fluid? Yes or no? Yes. So, nagkakaroon tayo ng increased concentration of urine. If there is an increased concentration of urine, what will be the specific gravity? Increase or decrease? Diba ang specific gravity natin is until 1.015? 1.0 to 1.015. So ano ang nangyayari sa urine specific gravity? Increase or decrease? Increase pa din. Why? Because concentrated ang ihip. So the more concentrated the urine, the more concentrated din ang inyong specific gravity. So specific gravity would reach up to 1.20 to 1.3 or 30. Number 7, musculoskeletal. Musculoskeletal system. Ano naman daw ang nangyayari sa musculoskeletal system? Pag buntis ang babae, lalo na pag malapit ng mga anak, there is a release of relaxin. There is a release of relaxin. Relaxin is an ovarian hormone. Relaxin is an ovarian-based hormone. So yung ovarian-based hormone na relaxin, okay, soften the cartilage. Soften the cartilage between bones. What is the bone na bubuka kapag ikaw nanganak? Your ischial spine. Ischial spine, your ring. Yes. In your ischial spine, di ba pag ito yung ischial spine mo, your ischial spine is connected by a cartilage. This cartilage will be softened so that it can accommodate the fetus kapag lalabas siya. Okay? So that is what is relaxin for. To soften the cartilages in between bones that would now facilitate the expulsion of the fetus. Are we clear? Yes. Number 8. GIT. Gastrointestinal tract. Okay? Gastrointestinal tract. So nagkakaroon naman tayo ng inactive. Inactive during labor. And active during labor. Okay? So bakit nagkakaroon ng inactivity of the GIT, okay, during labor? Okay? So the inactivity causes now decreased peristalsis. The inactivity is due to shunting of blood. Due to shunting of blood. Okay? Shunting of blood to the organs that is most in need. In this case, yung uterus. Okay? Uterus. Clear tayo dyan? So in general, nagkakaroon tayo ng inactive. So more or less, dapat hindi siya tatae. But there are instances na may mga babae din na tumatae during labor and delivery. Lalo the delivery process na. Not because peristalsis is high, but because ano nangyayari? Napupush na kasi yung tae na meron doon sa kanilang gastrointestinal tract. Okay? Napupush out into the anus. Are we clear? Yes. Okay. Am I too fast? No. Very good. You're adapting. I love it. Sanay na ba kayo? Since first grade? Gumagana lahat, no? Katawan, utak, kamay. Am I right? Yes. Ito na hindi gumagana. Bibig. Sumagot kayo. Number 9, neurologic. Neurologic and sensory response. Ano naman ang nangyayari kapag neurologic response? So, yung neurologic response is related to response to pain. O, question. Okay? Question tayo, basic anatomy and physiology. During labor, meron bang intense pain? O, intense ko na na-emphasize dyan. Sabi ko nga, the second most painful experience in the entire world. Pag ikaw ay babae at nanganak ka na, you can consider yourself strong because you have experienced the most painful pain na pwede mo ramdaman. Unless masunog ka. Kasi sunog ang pinaka-painful. Okay? Ngayon, related to response to pain. Kapag ikaw ay in pain, what autonomic nervous response is activated? Simpa or para? Simpa. Yan. Kasi ang pain is sympathetic stimulation. Ano nangyayari sa BP? Tataas, bababa. Ang cardiac rate, tataas, bababa. Respiratory, tataas, bababa. Pagpapawisan, hindi. Yan ang nararamdaman mo kapag ikaw ay in pain. Sympathetic nervous response ang tawag dyan. Okay? Saan nang galing yung pain, guys? Yung pain is because of the pressure na nangyayari doon sa inyo. Perineum. Plus, the possibility of tearing. Pwede kasi mapunit. Lalo pag hindi effective ang ating ginagawang perineal support. Am I right? Yes, okay. So basically, ang nangyayari kapag neurologic response is nagkakaroon ng increase CR and RR. Anong CR ulit? The cardiac rate or the pulsate and the respiratory rate. Are we clear? Yes, okay. Sa early part ng labor, nagkakaroon ng pain, okay, due to uterus and dilatation of the cervix. Nagkakaroon ng pain, early labor, contraction, pain, and uterine, cervical dilatation, uterine pain, or contraction pain in the uterus, plus cervical dilatation, cervical dilatation causes now discomfort due to pressure. Or the pain will be registered at level of 11th, at the level of 11 to 12 thoracic nerve. So this is the nerve responsible for the pain that you are experiencing due to uterine contraction and cervical dilatation during the early stage of labor. Okay? During the stage of labor. And during the late stage naman, during the late stage of labor, nakakaranas naman ng perineal stretch. So gusto niyo imagine kung ano ang tsura ng perineal stretch? Isipin mo lang, kung babae ka, isipin mo ang perineum mo. Isipin mo, lumuluwang iyon, nang lumuluwang, nang nabibinat, at possible mapunit. Yon ang tinatawag na perineal stretch. The perineal stretch would serve or would send a signal to S2 and S4 nerves. Anong S2 and S4 nerves? Sacral. Tama? sacral 2 and 4 nerves, or sacral 2 to 4 nerves. Sacral 2 to 4 nerves. Clear tayo dyan? Clear? So that is in relation to pain. Still, under your neurologic system, okay? Neurologic system, nagkakaroon din tayo ng increased pressure. Okay? Kasi nga, when you push, nagkakaroon ng pressure. Pati ICP mo tumataas. Clear? Ay, no ICP, intracranial pressure. So, pati ICP mo po ay tumataas. Clear? Yes. So, we're done with the changes sa mother. We're now going to your fetus. Letter B. Tama ba? Yes. Letter B. O, start na natin. Tatapos natin sa neurologic system sa mother. Doon na rin tayo sa inyong baby. Neurologic system. Neurologic system. So for the neurologic system, the fetus develop increased intracranial pressure due to increased intracranial pressure due to pressure caused by uterine contraction to the fetal head. Ulitin ko, increased ICP due to pressure caused by uterine contraction to the fetal head. Are we clear? Are we clear? Yes. Okay. So that's your neurologic system. Okay. Neurologic system. During this time, maapektuhan din ang stimulation ng cardiovascular, kaya si baby nagkakaroon ng fetal heart rate diminish. Fetal heart rate diminish. So this is seen in cardiac monitor. This is seen in cardiac monitor as early deceleration pattern. So FHR diminished, seen in cardiac monitor as early deceleration pattern. As early deceleration pattern. As early as deceleration pattern. Are we clear? Yes. Can I continue? It's number 2. Number 2, cardiovascular system. So, cardiovascular system. So, basically, the uterus is unaffected during this process. Okay? You just need to take note that an increase or decrease in fetal heart rate indicates fetal distress. Meaning, you have to know the normal value. Tama po ba? Yes. The normal value of your heart rate or FHR, if the baby is 120 to 160 BPM. Increase 160, fetal tachycardia. Decrease 120, fetal bradycardia. Both would indicate inconsequential fetal hypoxia. Okay, both indicates fetal hypoxia. Fetal hypoxia. No. Kadayo kami. Pas kami. Number 3, integumentary. Integumentary system. Pag sinabi naman natin integumentary system, it's the skin. Tama ho ba? Yes, okay? Nagkakaroon ng fetus ng tinatawag na petechiae or petechia or ecchymosis. Ecchymosis, okay, in the presenting area. So nagkakaroon siya ng ecchymosis. Ecchymosis in the presenting area. Ang ecchymosis na ito ay tinatawag na cephal hematoma. So basically, because of the trauma na pinapanganak siya, may pamumula o pamumuo ng dugo sa ulo ni baby. Sa skin lang naman yon, and that is normal. Okay? Commonly nawawala siya during the first month of life. Okay? Then, isa pa sa pwede mo makita ay yung tinatawag na caput succedaneum. Ano naman po ang caput succedaneum? Okay? Caput succedaneum is the edema on presenting part. Medyo parang namamaga yung ulo ni baby. Okay? Kadalasan elongated pa. Parang yan. Tapos, anong sabi ng matatanda? Kung nagsupli ka, no? Pagpagkal mo. Every day. Pagpagkal. Daras lumakal. Ano ba yan? Hindi naman pagkanamas niya. So that is your caput succedaneum. Again, kapag ecchymosis, anong tawag doon? Cephal hematoma. If it's the edema, caput succedaneum. Are you clear? Are you sure? Yes. Number 4. Number 4. Kaya pa ba? Yes. Para sa midterm? Yes. Kailangan ba umabol? Kailangan maka-MCA2? Of course. Kaya natin mag-aral. O, musculoskeletal. Musculoskeletal sistema. Dapat sistema talaga na ito. Musculoskeletal. Okay? Musculoskeletal. So kapag sinabi natin musculoskeletal, ano ang nangyayari? Because of the strong force of the contraction, si baby habang lumalabas, napupush itong batok. But since hindi pa maluwang ang vagina ni mother, ano nangyayari sa kanya? Yung attitude niya nagiging flexible. Nagkakaroon siya ng full flexion. Meaning, the chin to chest, knee to chest, your fetal position. Yan yung itsura niya habang pinapanganak. Okay? Nakaklamp ang mga hands, the chin, touching the chest. Yung paa niya, nakaflex, nakadikit sa chest din ang kanyang knee. Okay? Hanggang lalabas siya, ang unang lalabas is the bumbunan. Full flexion ang tawag natin dyan, the fetal attitude. Okay? Yan ang gusto natin. Okay? Yan ang gusto natin na paglabas niya. And that indicates vertex cephalic presentation. Clear? So dapat smooth yan. Pero pag mayroong sangga dito, fetal chin. Pag medyo lumayo, fetal brow. Tama mo ba? Yes. Pag may sangga din dito sa bato, fetal face naman yun. Face presentation. Pangit yung lahat. Dosiphalic sila. Ang pinamaganda dapat is your vertex presentation. Wherein, naka-full flexion siya, ang unang lalabas supposed to be the bumbunan. Okay? Paglabas ng bumbunan na yan, paglabas ng ulo, magkakaroon na external rotation. Doon mo nahawakan si baby sa baba, sa batok, then ila. Yun yung ginagawa niyo during delivery. Have you tried? Not yet. O, malalaman nyo, okay? Doon sa i-upload kong video mamaya, makikita nyo yung edifier or the mechanism of labor or the cardinal movements of labor. Was it discussed during your EINC? Yes. So at least may idea kayo. Okay? Kung ano yung sinasabi kong edifier. Clear tayo? Yes. So baby or the fetus is in full flexion. Fetus is in full flexion. Clear? And number 5. Respiratory system. So respiratory system. Take note that the process of labor, process of labor aids the maturation of surfactant. You still remember surfactant? Surfactant, which is the enzyme that is necessary for the alveoli to become mature. Lack of surfactant means fetal anomalies or the immature fetal or immature fetal lung that will lead later on into fetal lung distress. Okay? Or respiratory distress. Ano ang mga hormones that stimulates the production of surfactant? Lecithin. Your lecithin. Tama mo ba? Still remember that? Yes. Okay? So that is your respiratory system. Are we clear? Yes. At the same time, the contraction also helps fetus to expel, okay? Expel and clear lungs from fluids. Clear lungs from fluids. So any question? So those are the changes. Those are the changes under your physiologic, okay, physiologic effects of labor to fetus. Okay, physiologic labor to